What's up, everybody? Happy New Year. Welcome to BFR Tuesday. My name is Ed Cara. I answer questions every Tuesday regarding blood flow restriction training, either for yourself or rehab or fitness or whatever I can answer. And so if you want to ask a question, just throw a question up into the chat section. So your upper right corner, you should see chat, and I'll put in there, hello from Dallas, Texas. It is mighty cold. Well, at least for us, it's 48 degrees. Okay. So let me know what questions you have and I can answer them, or if I can't answer them, I'll find an answer. And if there's no questions, then I will chat about things that come in or questions that I get asked throughout the week. And you can always send me an email. Best email for this stuff is drlecara@bfruniversity.com. DRLECARA@bfruniversity.com. All right, Lewis, just a note, been using body weight suspension training with BFR and it's been effective. Perfect combo because you can easily adjust your resistance on the fly. Yeah, check this out. I got my wrong side, TRX core. I've been a master instructor for TRX suspension training and rip training. Well, not really rip training as much, but suspension training since, gosh, it's been a long time, 2012, 2013, something like that. I love the suspension trainer. It is nice to be able to modify the loads. And I will be releasing some video of me at my home gym with using the tonal. The tonal gym uses computerized resistance, and it can measure your velocity and power and other things. So it's been a very cool adjunct to my weight room there at the house. And using BFR with it super easy because you can modify the weights very quickly, and it's more on a pulley system. So it detects whether you're slacking on your range of motion or you're going too fast or any of those things. So pretty cool. Pricey, yeah, I think it's all relative, right? I mean, it's for me, I'm in my clinic probably 12 to 14 hours a day. And so trying to carve out time, used to be pretty religious CrossFitter, and the times are just not working for me. And so I found that I was missing too many workouts. So for me, having the availability in the garage made a huge difference, especially during COVID, where even if I only have 20 or 30 minutes, I will go out there and I'll jump on a Peloton, or I'll jump on the treadmill, or I'll do some swings or jump on the suspension trainer, and or I can do a 20-minute tonal workout and I can get it done. Whereas before I was missing them because I wasn't enough time in the day for me. And I know that's an excuse, but it's a reality, to be honest. Yeah, so any questions regarding BFR today? John, Happy New Year. John and Callie, hi. I'm an Ironman class athlete. I understand that 20 minutes is the maximum for the cuffs. Can I do multiple sets of 20 minutes each at 50% of pressure at a heart rate of 80%? Yeah, absolutely. You can, what I would recommend is that if you're healthy with no pre-existing conditions, 30 minutes is probably, I'm supposed to say 20 minutes. Lawyers don't like it when I go outside the box, but in all reality, we're at partial occlusion. It's not like surgery where you're hours and hours and hours at full occlusion. Now we are exercising, so it is a little bit different, but you can go up to 30 minutes, especially a type of athlete that you are. And then just take like a 10-minute break, 5-minute minimum. And then you can reinflate for another 20 or 30 minutes. It's fine. And then John, think about using interval training with BFR. Those are all subjects I cover in my level 2 course, where we talk about interval training on a rower, interval training on a bike, interval training on a treadmill, sprint work, trying to reduce your overall volume, because you guys do so much time in the saddle and so much time on the road or in the pool. You can, really kind of reduce your time and stress under the joints by doing more interval type work, either with or without the cuffs. Sometimes you can do intermittent BFR, meaning I'm on the bike doing sprint work for 30 seconds without the cuffs. And then I jump off the bike and I put the cuffs on and I inflate them. And then I sit there passively for 2 minutes, deflate, jump back on the bike without the cuffs, 30-second intervals, jump off the bike, use BFR. So that's called intermittent, where I'm doing intermittent BFR, not during the exercise, but during the rest time. It makes sense with those longer periods. For me, it doesn't make sense in a short period like with resistance training, although both have been shown to be effective for strength and hypertrophy. So just a side note. So yeah, to answer your question, absolutely do multiple sets of 20 minutes or 30 minutes each at 50% of pressure. For the legs, you're going to need probably 60%. That's about going to be your lowest, especially somebody as fit as you are as an Ironman class athlete. You're going to need to cook yourself a little bit more for physiological adaptation. So I would look at 60% LOP, and either look at your VO2, because I know most of you guys measure that, or look at your heart rate reserve, which is the calculation. I'll try to use one of those, like if you go into this, click on this thing on YouTube. I haven't figured out how to do that yet, but on this tile, and it'll take you to a link on how to calculate heart rate reserve, which is a pretty good estimate of your VO2. So you're going to be needing to go at about, probably close to 50% heart rate reserve minimum on a steady state type exercise with BFR at 60% limb occlusion pressure in the lower extremity, is my guess without ever meeting you or seeing you. All right, great question. Gosh, any other questions for me today? Okay, a little gold nugget I wanted to share is when you're establishing your limb occlusion pressure, I would recommend doing it, especially in the legs, doing them on each side. Do them bilaterally, do the left side and do the right side, because you will see differences left to right. And if you see a major difference, like I had a patient come in last week, and we're working on some medial epicondylitis and lateral epicondylitis, tennis and golfer's elbow. I measured his left arm, and can't remember exact numbers, but it was about 180 millimeters of mercury for his LOP. His right side was about 50 points less. And, looking at his arm, doing a circumferential measurement, there wasn't that big of a difference. So I was like, oh, that doesn't seem right. So I redid it, and they came back within 1 millimeter mercury difference. So, the variable there might have been I didn't have the cuff on equally as tight one side versus the other. So just make sure that you're nice and tight with the cuffs before you inflate, as tight as you can, really. You shouldn't be able to get more than, like one fingernail underneath the cuff. So if I show an example of this, and I'm putting the cuff on, and when you're doing this on yourself, make sure that valve is facing forward so it's easy to attach the pump. So I'm putting this on. And I'm really trying to tighten that up as much as I can and get it as high as I can. And so when I try to get a finger underneath, I shouldn't be able to get more than this little bit. If you can get 2 fingers underneath there really easily, that means it's too loose. Or the cuff is too big. You might be needing a smaller cuff. If you're tiny, like I have some athletes that are like cross-country runners, women, and they're super tiny, then what I need to do is I need to have some sort of like cloth underneath to make up a little bit of space and gap. And that cloth I usually use is, it's these little sleeves that I've made for my patients that are protect the skin, but they also occupy some space. So nice and tight. I shouldn't be able to get, like, see, I can't get my finger underneath there, and you want it to be, equal on both sides. And then I can plug in and I can inflate, and that'll give you as symmetrical as you can on both sides. So take home message, make sure that the cuff is on nice and tight before you inflate. Check limb occlusion pressure on both sides. And when I'm doing the legs, make sure that you're standing with even pressure. The tendency is, if I've got a cuff on, to shift my weight to the other side. You want even pressure through your feet. So that way the muscles are contracting the same amount to keep you upright. The gravitational contraction, it's about 30% maximal voluntary contraction to maintain your upright position. So there is some contraction going on. All right. Any other questions? If not, thank you guys so much for joining me. I hope that was helpful, and try to stay healthy. Good luck this year, and I will be back next week, and we'll talk more BFR. Thanks so much. Bye for now.